that I made as a part of like a IM shelf review for people. And the goal of these is to be short, and they discuss a question, but I try to go a little bit above and beyond that and hit a couple of topics. And so I'm doing these questions, important concepts. So I'm going to try to do as much of these as I can because they're really short and I have a lot of time. I just took step two. So yeah, let's see. So in this one, we have a 20-year-old female that presents with a pressure-like substernal chest pain with exertion. So this pain is really characteristic of a typical like angina. It has a lot of characteristics that makes me think that it comes from the heart and not everything else. And what are those characteristics? One, that it's associated with exertion. So sometimes in questions I saw that the person had epigastric pain, but then it subtly mentioned later in the question that this epigastric pain is associated with exertion. And this is an older diabetic female, then that's also concern for cardiogenic cause of pain. Okay, but in a young patient, in a very characteristic, you need a really characteristic type of pain to be able to say, oh, this is a cardiac pain. Okay, but the other causes that can cause chest pain, you can think of the musculoskeletal types of pains. You can think of the pleural types of pains. So it's pericarditis, it's just pleuritis. So sometimes the patient, this young female, they may have lupus and they may have pericarditis, pleuritis. Uh, yeah, but this person, associated with exertion, the location and the character of the pain makes me really think this has to be a cardiogenic source of pain. And the review of systems is clear. The patient did have a childhood murmur uh, and has differential blood pressure in the right and left arms. So when you hear differential blood pressure in the right and left arms, a lot of you are thinking coarctation of the aorta, and that's correct, especially in a young patient. But keep in mind that sometimes you might see this presentation in older patient, and it would be wrong to think that coarctation of aorta is the best answer in that situation, in my opinion. Just because if you're 65, it's really rare. It's really unlikely for you to have a coarctation of the aorta discovered at that age. So when you're thinking of an older patient, you should be thinking about someone who has a lot of atherosclerosis in their arteries, and that atherosclerosis is in their brachial arteries, and that's causing the differential in blood pressure. Sometimes they give you that type of a person, so older person, differential blood pressure, and then they also get acute episodes of dizziness when they move their head or something, or when they move their hand up. So some of you are already thinking about vertebral or brachial steal syndrome, which is basically that atherosclerosis is causing some of the blood to get bypassed by the vertebral arteries. Okay, and that is giving these patients a sense of dizziness acutely. That's a question that I've seen show up a lot. Okay, and there's a mild systolic murmur at the right upper sternal border. Right upper sternal border is where the aorta comes off. That's the direction it's facing when it comes off. So this could be uh, the coarctation is probably closer to the initiation side of aorta, closer to the actual valve. Okay, and so the diagnosis is probably a sort of stenosis of the aorta, just distal to the valve, to the aortic valve, and the cause of pain. So when you're thinking of cause of cardiac pain, most of the time the only thing that comes in my mind, if it's actual from the myocardium of the heart, the thing that comes in my heart, in my mind, is ischemic type of pain, especially in a situation like this that's exertion dependent, that really has everything going for it. And the reason for this ischemia is that the heart is basically pushing against abnormally increased resistance because of this stenosis. Okay, so they might not tell you ischemia per se. They might tell you what ischemia means, which is decreased oxygen availability to the myocardium, basically. They might just give you any variations of that, but the answer to that question would be something like that. Okay, thank you, and I'm gonna go make the other questions. And if you have any questions about this one, I'll try to answer it by commenting underneath this video.